Well, hello, welcome everyone. I really appreciate you coming to talk with us today about this project. We're very excited about it, and we're looking forward to your questions afterwards. I should say at the very beginning that neither Nick or I are historians. We are historians. Neither of us are doctors or medical professionals. So what we are going to be presenting is really historical content, and medical questions will probably have to wait for the next presentation in this series, which will be with Dr. Fekete. He will be able to answer many detailed medical questions, particularly about vaccines and so forth. But this is really a look back 100 years ago with a little bit about what we can learn about it today. Just a tiny bit of context. The Mütter Museum of the College of Physicians of Philadelphia, many of you may be familiar with it. It is a museum of medical pathology, of medical specimens that was used as a teaching collection for doctors starting in the 19th century. But it more recently has morphed into more of a museum for the general public that talks about what can go wrong with our bodies, teaches us stories about all things having to do with medical history. So the museum wanted to do something to commemorate the centennial of this pandemic, which was one of the greatest health disasters in history and certainly in recent history. So I was brought on. I'm an independent curator and exhibit developer, and I worked on their previous exhibition on Civil War medicine. I was brought on to be the guest curator for this exhibition. But Nick and I are only two of a very large group of people who are working on this multifaceted project. So to get into it, why should we care about something that happened 100 years ago? Well, because as we know, pandemics are always with us. They're always emerging. Every day, there's some new story in the news about disease. The threat of a recurrence of a very large death event that would kill very many people is constantly with us. It's always hanging over our heads, particularly with new diseases emerging. These magazine covers are from 2017, but stories like these are really appearing all the time. So we think that looking back at what happened 100 years ago can help us cope with what may be coming down the pike. So, almost a century ago, one of the most deadly disease outbreaks in world history. There are global estimates that the deaths may range from 50 to 25 to as many as 100 million people worldwide. In the United States, about a quarter of the population was infected. About 675,000 people died. These are astonishing figures, off the charts, literally off the charts. You can see this immense spike here in US mortality rates from different diseases, with the top line representing influenza. Now, it was called the Spanish flu not because it came from Spain. In fact, it probably didn't come from Spain. There's still a lot of discussion about what its origins were. It first appeared in the United States in an army camp in Kansas. And it may have arisen in the trenches in England and in France during World War I. It may also have come from China. We do know that it was an avian virus and originally originated in birds and then jumped to humans. I'll talk a little bit more about that at the end, how we found out about where the virus came from. But this happened at the very tail end of World War I. The World War lasted from 1914 to 1918. So this virus arose in the final year of World War I, and its movement, its lightning fast movement around the globe was really facilitated by these movements of troops and people all around the world during the war. With the result that you get scenes like this, with hundreds of thousands of people being sick all at once, very high infectious rates, very high death rates, an extremely virulent flu that was different from the regular seasonal flu, which in itself is certainly a killer. But this flu was unusual. It hit very fast. It affected young people very strongly. You could start getting sick in the morning and be dead by night. Part of the reason it was so bad in the at this time is there were no vaccines, there were no antibiotics against the secondary infections. The influenza virus weakened the respiratory and immune systems and made the body vulnerable to other infections, particularly pneumonia. Most of the people who we say die of influenza actually died of a combination of influenza and bacterial pneumonia. So how can we start to understand this pandemic and really get a grip on this event that happened so quickly and was so severe? This is a quotation about how the pandemic was a real challenge to doctors at the time because it happened so quickly. They were experimenting, they were trying different techniques. Most of the things they could only provide palliative care. And their efforts were really not very effective. And then looking back on it, we try to kind of unpack this event. And it's hard to tell the story in a very traditional, step-by-step kind of way. So for us, the challenge of putting on an exhibition, packing a story like this into one single room is pretty difficult. Here's the gallery, which some of you may have seen. It's about 1,000 square feet. So it's not very large. It was renovated for 2013 Civil War exhibition, which was a long-term exhibition. And Spit Spreads Death will also be a long-term exhibition up for about 5 years. In order to figure out how we go about telling the story, we commissioned an evaluation firm. And we found out, we surveyed visitors, and about half of them had some knowledge about the pandemic, but most of them did not. And they were interested in a number of different topics: why it was so deadly, could another pandemic happen in the future, how the virus spread, how the city dealt with the death of so many people, what was it like being in the city at the time, what was the city like 100 years ago. They also wanted to see mapping techniques to show the spread of the disease, statistical information, and they were really interested in personal stories and emotional connections. So we took all of these as guidance as we started to shape our exhibit. Project concept. We found out it's not terribly difficult to argue with the premise that the influenza pandemic severely affected Philadelphia, touching every neighborhood and every family. 20,000 people died here in 6 months, and about 12,000 of those were within 6 weeks. There were weeks where thousands of people were dying, hundreds every day. Very unusual for the city. So, and though there were many unanswered questions about the pandemic, if we try to understand what happened here, it can really help us deal with the threat of potential future pandemics, we think. So we had goals. We wanted to integrate an artist project with the historical content of the exhibition, and I'll talk a little bit more about that. We wanted to show how the disease spread, and no one had done this before. We do have statistics about total deaths in Philadelphia that the city compiled at the time, the following year, but we don't really know where it actually hit, what neighborhoods were hit the worst. Wanted to explore how the city responded, memorialize the people who died. This pandemic has often been called the forgotten pandemic because it really didn't make it into the history books. If it is in the history books, it's oftentimes just a footnote to the war. So how can we sort of create an appropriate memorial to these people, these lost people? And of course, we want to connect it to the present and to the future. So these are our very lofty goals. And so we have some tools that we can use to tell the story. We have images, we have medical information, we have say a lung specimen that can show you what pneumonia looks like. This is not specifically from the flu itself, but does show how the lungs filled up with fluids from pneumonia. Basically, people were drowning from the inside. Their lack of oxygen in their blood, turning their lips and faces blue. They had high fevers. They were often delirious. It was a very, very cruel disease. We also have some personal artifacts, documents. An event like this that happened very quickly did not leave very many artifacts behind, which makes it a challenge to create a museum exhibition. But we do have a few things. We have letters written by a student at Bryn Mawr College, which was under quarantine. We have a handbag that a young woman bought as a Christmas present, but was never able to give because she passed away during the pandemic and was pregnant at the time. So a very poignant remembrance of a lost person. We have a few things like that. We also have data. We have lots of statistics. It was a very statistic-happy kind of time where government authorities, medical authorities really wanted to try to understand diseases, try to understand what was happening in human populations. So they gathered a lot of statistics. And Philadelphia inevitably made it to the top of the charts in many of these statistics for the pandemic. Another source of data is these death certificates, which Pennsylvania started collecting in 1906. So we have a very detailed record of the impact of the pandemic in these certificates. And we decided that we would take all of the death certificates and we would transcribe all of them, and then we would use them to map the progress of the pandemic through the city. So a very ambitious project, which Nick can talk a little bit more about since he was the head honcho on this data production, along with a number of dedicated volunteers. So we wanted to do this not just for the data, not just to see which neighborhoods were hardest hit, but to acknowledge these people as individuals. Once you start looking at these death certificates, you can see that they not only give you medical information that someone died of pneumonia following influenza, the amount of time that the doctor spent with them, where they were buried, so on and so forth. But we really felt, as we started looking at these certificates, that these are stories of people. These are miniature capsule lives of people who are not in the history books. So we have, on the left, we have Eliza Bonneau, who was born in North Carolina, and evidently one of the people who came up to Philadelphia in the Great Migration. Many people came up for wartime jobs as the city was mobilized for war times. She was only 19 years old when she died, and she was in the early stages of pregnancy. We also have Antonio Clerici, born in Italy, so a European immigrant, and he also passed away and was buried in the city potter's field. His family did not have the resources to bury him in a proper cemetery. So every single one of these certificates, and we've looked at 24,000 of them, have amazing stories to tell. So we want to bring out these stories in the exhibition. In order to try to start telling this story, we decided that we wanted to have a major art project. With support from the Pew Center for Arts and Heritage, we hired Trevor Smith, who is a curator at the Peabody Essex Museum, to help us find some artists who would really help us to get across the emotional dimensions of this story. That's very important for us to be able to not just tell a medical story, but really tell a human story. So Trevor helped us find Blast Theory, who is a British artist group who are located in England. And they have done a number of projects that are very much focused on audience and on participation. And they address all kinds of present day issues like the surveillance society, like literacy, like societal inequality. So we wanted to bring them on board to help us create something that would speak to this major health event. They have created are in the process of creating a parade that is going to be mounted on September 28th, so in just a few weeks. And we hope that you will be able to join the parade. Every person who participates in the parade will be representing one of the pandemic victims. That's one use we're making of that death certificate data. You'll be able to choose a person and represent that person in the parade. The parade is not just a somber memorial, it's also a celebration of public health workers, the people who help keep us safe from disease today. So it will have a musical piece that will be played on people's cell phones. There will be illuminated floats. It should be a really moving, beautiful special event, and we hope you can participate. And this parade will then be filmed, and the film of the parade will go in the gallery as a record of this event. Now, why a parade, you might ask? And that's because there was a parade 101 years ago that was an important event in the spread of the flu in the city. This was the 4th Liberty Loan Parade, which was held on September 28th, 1918. And it was a parade for the Liberty Loan drives, which were bond issues. The government issued bonds to help fund the war, and people were encouraged, I would even say arm twisted, to buy these bonds. Buying the bonds was a mark of patriotism. You could wear a special button if you bought the bonds. You could put a flyer in your window. You could sign that you had bought one. It was really seen as a mark of participation, of support of the war effort. Wait, go back. So for this parade, 200,000 people gathered on Broad Street. And if you were present for the victory parades after the Phillies game, the Phillies World Series victory, and after the Eagles won the Super Bowl, you have a sense of the crowds that would be present on Broad Street for a parade like this. So this was a 2-mile parade, 200,000 people. The virus had appeared already in Philadelphia. It had been brought to Philadelphia, to the Navy Yard, by sailors from Boston, after having originated in the Midwest, in an army camp in the Midwest. So it was definitely starting to spread, and the authorities knew that the flu was present in the city, but they thought it had been contained to the Navy Yard, that it would not be a big risk to put on this parade, even though there were doctors who warned them of the danger of crowds. But the pressure to put on this display, to participate in this patriotic event, was so great that the parade went on ahead. And just a few days after, the infection rate, the death rate spiked in Philadelphia. Every hospital became full. People started dying by the tens, dozens, hundreds every single day. And the worst day, nearly 900 people died. So one of those enormous spikes in deaths and infections. And this exhibit will explore what effect that had, both short-term and long-term. This is just a plan of the gallery so you can see how we're arranging things. We want people to kind of walk through the story of this pandemic and really have a sense of what it was like to be in the city at the time, to be living through this, to be afraid that your family, that you would be the next to be hit. So you will enter, and this entryway will ask the question. This is the big question. What happens when a disease strikes a city? What do people do? What would you do? This entryway, then there'll be a little theater where this black screen you see on the right, that's where Blast Theory's film will be playing, and will explain about the two parades, the parade 100 years ago and the parade today. Then you'll start exiting through and walk through the rest of the gallery, and you'll see the context for this parade, the wartime home front, Philadelphia being a heavily industrialized city, packed full of people. The estimate is that there was about 1.75 million people official population, but 250,000 extra people came to the city for war jobs, because all of these factories were mobilized to create material for the war, everything from helmets to ships to hats to uniforms to artillery. The city was packed and buzzing full of people when this disease hit. Then you'll see an animation of what happened when the pandemic struck on that black mark represents the screen. And this is where we're really starting to use the data. We have taken, with a group called Interactive Mechanics, we've taken the data and we've created what we call the map animation, where we're going to see how the pandemic spread across the city of Philadelphia. Every single dot, we've geomapped all of the deaths and every dot represents an individual death. So you'll be able to tap the screen. These are just screenshots. I don't have an active animation to show you. So you'll tap the screen, and then the dots will start appearing on the screen, and the graph on the right will start going up with a ticker counting the deaths. So you start to see how the deaths were distributed and how they were concentrated in the areas where there was the highest concentration of population, and also in the areas where there was a high concentration of poverty as well. You can see South Philadelphia is very deeply concentrated there. And you see here on the right that enormous spike in October. And this is not even the total of deaths. This is just part of in the sequence. So how unusual this is. We won't just be showing total deaths on this animation. You'll also be able to filter it, because we have all of that information in the data as well. So you can filter by sex, by ethnicity, by age group. And you'll be able to see different versions of the animation, so you can see how different groups of people are affected and where those groups of people are concentrated. So we're hoping that this will be a really fascinating thing for people to see, and no one has done this before. There's not been this kind of granular data collection and visualization for the city for this event. Then as you start going around the gallery, you'll be able to see what happened when the city became in crisis from this event. And we have pictures representing different groups of people and talking about how they were affected. We have African-American soldiers who were stationed in the city. We have nurses who were working during the pandemic to help flu victims. We talk about how the city set up emergency hospitals, how they put out bulletins warning people about different measures they could take. Cover your mouth and nose when you sneeze, avoid crowds, try to stay in well-ventilated places. All of these kinds of standard advice that you would give in the case of an epidemic disease like this. And we will have some objects on display to also help give this context. So it's not just officially the city that was responding to this crisis after their one big mistake of allowing the parade to go forward. There were also many volunteer groups who were already organized to doing war work, doing war volunteer work. So they pivoted to help with this crisis. There was an emergency switchboard, telephone switchboard at Strawbridge and Clothier, where you could call to get help with influenza if you needed a doctor or a nurse. There were taxi drivers who were ferrying people around. There were women who were going house to house and helping people with food and clothing and medicine. So there was a lot of volunteer activity going on, as well as the official city activity. The Red Cross played a very large part in this. So even though the city was suffering because it had a shortage of doctors and nurses, many of the doctors and nurses were serving overseas. There were many people here who did pitch in and try to help, and people like medical students and student nurses who were barely trained found themselves in charge of taking care of patients in these emergency hospitals. So we have some very powerful stories about this time, about this crisis, about how people coped. Our second digital interactive focuses on how the flu pandemic affected different neighborhoods. So we're taking that data that you saw in that first interactive and zooming in for a closer look. We're calling that section the sort of neighborhood impacts. We're going to talk about how Philadelphia was really a city of neighborhoods and about all the different communities who were here. And I should also mention in this section on the left, what you're seeing is there's a place where you can actually pick up an individual death certificate. There'll be a stack of them, all different, and you can look at that and sort of decipher and try to figure out what happened to that particular person. We found in the public events that we put on, where we brought out these death certificate handouts, that people are really fascinated by them. They start shuffling through, they try to find someone who had their same occupation, who was their same age, who was their same ethnicity, who lived in their neighborhood. So we're hoping that this will be very interesting, particularly for locals, to try to pick out an individual death certificate. So this, what we're calling the Neighborhood Explorer Interactive, there'll be 2 touch screens where you'll really be able to see how it affected citizens and neighborhoods. You'll have the option to either search the city or you can explore by neighborhood. We've chosen 4 different neighborhoods to feature. These are neighborhoods that were impacted strongly by the pandemic. One of them is South Philadelphia. Again, these are screenshots. South Philadelphia, we're also doing Brewery Town, we're doing Kensington, and we're doing Graduate Hospital. And in each of those, we're focusing on a different ethnic group. For South Philadelphia, it's the Italians. For the Graduate Hospital, we're going to be talking about the African American community, both the longer established community and the recent migrants coming up from the South in the first wave of the Great Migration. For the Brewery Town neighborhood, we're going to be talking about the German American community. And for the Kensington neighborhood, we're focusing on the Irish community. So this is a chance for us to delve into all of these different communities that made up this teeming city and to see what happened to them. So each of these neighborhoods is going to have an introduction talking about how the pandemic affected them, what the neighborhood was like, what were the demographics. Then we have points of interest, which are churches and hospitals and other kinds of community landmarks. We'll also have stories, such as the story you see here, where we've found stories in a newspaper scrapbook that the College of Physicians owns. We've pulled those out, given them geocodes if they have addresses, and put them on the map. And every dot you see here represents an individual death. You can click on a death and you can click on a dot and it'll bring up the data for that person. So you'll be able to see if there were on a street, who was affected on the street, if there was a particular family that lost more than one person. All of that data is going to be in there. And I should also mention that you'll also be able to search. So you can search by a street name, you can search by a family name, you can find who died on your block, you can find an ancestor perhaps, a relative, and you can also search by a location. So by landmark. If you're not familiar with the city, you could search by the Mütter Museum or Independence Hall and see what was happening around in that neighborhood. So this interactive, I should mention, is not just going to be in the gallery, it will also be online later on next year. So we're hoping that it will be a long-lasting resource for people to use. I should also mention that the death data itself, the data set, will also be online and publicly available for people to do more research on it. So we're hoping that this is just the very beginning of a long-standing collective research project finding out about this disease and its impact in Philadelphia. Okay, we're going to continue around the gallery and talk about the burial crisis. This was something that was very traumatic for the survivors. When survivors told their stories, they really remembered the impact of having so many dead bodies around. When it got to the point of dozens of people, hundreds of people dying every day, the undertakers ran out of coffins, the undertakers ran out of space, cemeteries could not bury people fast enough. So bodies were sitting in people's homes, bodies were piled up in undertakers' garages, the city morgue got overfilled. So for a couple weeks, there was a real sort of horror scene that for many people recalled the Black Plague, the Black Death of the Middle Ages to them. Eventually, people started mobilizing to get the bodies buried, and the Catholic Church was a large factor in this. The Archbishop got people enlisted seminarians to go around the city and pick up pick up dead bodies and bring them out to Holy Cross and Holy Sepulchre cemeteries outside the city, and the seminarians dug mass graves to give temporary burial to these tens of hundreds of people. So there were about thousands of burials in these cemeteries and in other locations as well. The Potter's Field at 2nd and Luzerne was another place where temporary mass graves were dug. Now these coffins were labeled, and you can even see, I think, in the foreground at the very bottom of the picture there's a label on the coffin. So the idea was that they would be dug up and reburied after the crisis had passed. But the important thing was to get these bodies below ground because of the danger of disease spreading further, certainly not the flu, but other diseases being spread by having these bodies around, and also just the psychological impact of being surrounded by bodies. These boxes that you see in this rendering here, in the designer's rendering, are reproduction coffins that we're putting in the exhibition to bring home this idea of death and suffering. Then we also have a section about memory and loss. So in the immediate aftermath of this pandemic, what was it like to have a family where you'd lost a child, a parent, sometimes more than one member of your family? The family we're featuring here is an Irish immigrant family who lost a little sister, 3 years old. They didn't talk much about the flu, and this is a theme that comes up in these family stories, is that the surviving members didn't talk very much about that loss, but they certainly remembered it, and it was something that remained with them. In this particular family, the father would go down into the basement and sit among the little girls' dolls and toys, even though he didn't really express what he was feeling. So this is a story that has come down to us from a descendant. So these were very private memories. They were not necessarily remembered collectively. There are certainly World War I memorials all over the city. There's not a memorial to all of these flu victims. We're trying to bring out these stories a bit. And finally, we have a section on legacies and lessons, where, again, in the context of a gallery, we're only going to be able to really touch on some of these things. We have very compelling stories of Girard College, the boarding school in Philadelphia, founded by the financier Stephen Girard. It was a free boarding school for orphan boys at the time for white boys. It is now coeducational and integrated. But we've been working with the archivist there to uncover the stories of these flu orphans. And we found one who became whose name was Earl Tyson, whose father died in the flu, whose family couldn't finance his education. So he was admitted to Girard College and graduated, served in World War II, and became a Presbyterian minister. So these flu orphans are kind of a living legacy. These people who survived and went on, even though they were lacking their parents, and then built lives. That's one piece of the legacy. Another piece of the legacy is what we've learned about the flu medically. Certainly in 1918, there was no vaccine. They believed that the flu was a bacillus. Scientists thought that they had identified what the particular germ of the flu. It turns out they were wrong. They did try to create vaccines and administer vaccines. The vaccines were not effective. Very few of the medicines they used were effective. Again, it was just palliative care was pretty much all they could do, and relieving some symptoms. But because of this enormous public health crisis, the work on influenza and of trying to identify it continued through the next decades. And by 1933, the virus was isolated. Then the next challenge was to get a vaccine. And that work continued through World War II, and the vaccine was first tested out on soldiers, and then it was approved for civilians. Then since then, there have been major pandemic events in the 20th century. There's the Asian influenza pandemic of 1957, the Hong Kong pandemic of 68 and 69. Those were different types of the virus. Then there was a pandemic that wasn't in 1976, the swine flu outbreak, where there was mass vaccination in the US that may have helped to this outbreak not turn into a pandemic. By the 1990s, the scientific techniques had advanced enough that scientists were really able to analyze, to get the actual virus from bodies that had been buried in the permafrost in Alaska and analyze it. The genome was reconstructed in 2005. Then in 2009, there's the swine flu pandemic, which was an H1N1 type influenza virus, just like the 1918 virus, the Spanish flu virus. Now there are some clinical trials going on for possible universal vaccines for influenza. There is a lot of work being done to try to combat this disease, which still kills many, many people annually, and also poses the threat of another pandemic virus, another virus emerging that people do not have immunity for, that could have the same kind of very strong effects that the 1918 virus had. So we end this story with kind of circling around, talking about how the same things that were done in 1918 in terms of communication, public communication, helping people to give people accurate information, give them information about what they can do to prevent catching this disease, to deal with it when they get sick. But I want to make one little point, is that at the time they did believe that spit spreads death. This was a very powerful message. It was derived actually from a anti-tuberculosis campaigns, which had been trying to combat tuberculosis by encouraging people not to spit. So when the flu epidemic came along, this message of anti-spitting was all sort of ready to go. So the city put up signs everywhere. It was kind of a little too late, a little too little too late, but it was certainly a visible effort, a signal that they were doing something in the face of this crisis. But the secret is that spit was not actually a vector for the disease. They did believe at the time that spit was a major carrier for the virus, that spit on the ground, when it dried up and was in the form of dust, was inhaled, and that you could get the virus that way. It does not work. That's not how the virus works. It really is spread by sneezing and coughing, by droplets from the respiratory system. But it was something that they could point to, that they could say, we're doing something about this because we're keeping people from spitting. So this idea of getting information out, trying to control public behavior, is something that's a continuing thread in public health. And this use of signs, we use this sign as an iconic image in our exhibition, because the sign you see on the left, the striped sign underneath, that was a sign for the Liberty Loan Parade. And when the flu broke out, they just slapped those spit spreads death and don't spitting signs all over the Liberty Loan signs. And then signage as well, here on Broad Street in 2017 against Zika. So we don't know what the next pandemic will be. All we can do is try to prepare. A lot more tools today. We have the vaccine, which is the vaccine against seasonal influenza, which is the powerful tool we can use against this disease. So all we can do is sort of look back, try to see what lessons we can pull out of this crisis, and be prepared for the next event without being too scared. So I want to say thank you for listening to this presentation and to participating. And Nick will be speaking next a little bit more about the data, but I want to acknowledge our funders, the Pew Center for Arts and Heritage, the Pennsylvania Historical and Museum Commission, and the Institute of Museum and Library Services, as well as the Groff Family Memorial Trust, who have been helping us with this massive project. It's not just the parade and the exhibition. We'll also have a full slate of other public programs. We'll have a silent film series. We'll have neighborhood walking tours. We'll have all kinds of other events. So do visit the museum website for more information. Follow the Mütter on social media for parade and exhibition updates. And we hope to see you at the parade or in the exhibition. So thank you very much.
Wonderful. Jane, thank you. Thank you so much. And as I prep to hand it over to Nick, I just want to say thank you for elucidating on so many of my own questions around this, and definitely to the audience, if you have questions, please, there is a Q&A box in the bottom of the bottom screen. So I'm about to prep the next presentation. So thank you for your patience, everyone. All right, and I am very pleased to turn it over to Nick.
Hello. My name is Nicholas Bonneau. I'm a Ph.D. candidate at the University of Notre Dame, and I started about 3 years ago as a Wood Institute Fellow at the College of Physicians, and have been working on several projects since then, and moved out here to Philadelphia as a research fellow at the University of Pennsylvania. I am here now to give a little bit of background on pandemics themselves. What do we know? How do we know what we know? What kind of information does this give us about the people who are living through these pandemics? And a little bit more information about how we've used some of these past tools to give us insights into this, as Jane said, forgotten pandemic. So to start off, what we think are the top 5 pandemics of all time are the number 5 is the Antonian Plague, number 4, the Plague of Justinian, number 3 is our Spanish influenza of 1918 to 1919. The AIDS HIV epidemic is number 2, peaking in 2005 to 2012. And finally, of course, there is the Black Death. So how do we get at these things? How do we make an ordinal list of these types of pandemics? How do we understand how many millions of people died, and how do we what kind of source material are we getting that from? Well, you may or may not be surprised to know that the sources are rather fractional. For the Plague of Justinian, as just a quick example, 25 million people were believed to have died in the Mediterranean in a disease that started around the mid-16th century, and was thought to have decimated the population of the Mediterranean and Europe itself. How do we get all this? Well, we get it from one author, one single author, Procopius, and this particular quote from a very large multi-volume set of his histories, about 4 pages, focus on the plague, and this one particular quote is where we get this 25 million. Now the disease in Byzantium ran a course of 4 months. Its greatest virulence lasted about 3, so we start to immediately, historical epidemiologists and historians of medicine and disease, we pull together and start to visualize a normal curve. That at first the deaths were a little more than the normal, then mortality rose still higher, and afterwards tail of dead reached 5,000 each day. So we're in the thick of the epidemic there on both sides. And again, that comes to 10,000 and still more than that. So that's where our peak is. And when we make a rough estimate of, okay, say 5,000 people dying for a certain amount of time, 10,000 people dying in a peak, and then extrapolating that against what we think the population of Europe was, especially surrounding particular cities like Antioch, Constantinople, of course, Ravenna, Marseille, Lyon. So that's kind of where we get that. We don't get, what we definitely don't get, is an idea of how this affected people on the ground. The supposition has been in popular understandings of past epidemics that these come from a sort of a terror that people feel. People get scared, people get nervous, but there is some pushback against that, especially recently by Samuel Cohen, that when we dig deeper, it's more a story of cooperation. Looking into the Black Death, this particular artwork from 14th century France depicts people burying the dead. And yes, it's terrifying, but if you look closer, these are cooperative movements. These are many people working together, 2 people holding coffins, 4 people holding coffins. These are sad faces. We're limited, of course, by the conventions of expression at the time, but we get an idea that this was something that people were working through together. Now, of course, there were pogroms going on at the same time. There was fears of outsiders that were affecting the way people interacted as well. But it does begin to help us question how pervasive that was, and maybe if that was indeed the default reaction. What we've done, I'm sorry. And so at this time, to get a better understanding, many people began counting deaths. In London, we have the stories of the searchers, these women who would go out and find out, look for all the people that had died through the course of the day and report back what the cause of death was to various media of the time. Usually that was meant for entertainment value, but of course people like John Grant and William Petty began collecting these and giving us a better image of the disease environment at the time. When we get to the Spanish flu pandemic, of course, this is how we get these totals. We have those certificates. We have collections of this data that are then published later on in 1920 with the 1920 census. There was an addendum outlining what cities had been hit hardest, exploring some of the variations of demographics among people that were hit, and giving us some idea of what the actual experience was in terms of those numbers. So what are we doing? Well, we are taking these and doing something similar. We're looking specifically at Philadelphia and trying to see what these primary source documents can tell us about what was going on. We don't want to just do what Procopius did and just give an estimation. That's been done. But we want to not just look at the relationships among people, but to give an idea of what the overall sense may have been, something in between the individual experience and the bird's eye view that statistics offers us. So to give a beginning sense of where these things are, you can see we have a graph here of total deaths versus flu deaths. This is actually from a few weeks ago, but yes, I believe these are the numbers that we're working with. Flu deaths may have increased a little bit there, a couple thousand. But you can see the surge, if you look down, around September 28th. It's very difficult to say, just looking at this graph, that this is caused by the parade. We don't tend to think about linear causality when we look at epidemics, as many of you know. There's many factors that go into spreads, but we do see within a few days there is that exponential increase in deaths. It certainly did not help prevent anything to have 200,000 people gathered together on Broad Street. And we can see that it did continue into the fall, but certainly that dark October was a terrible time to be in Philadelphia. Other information we can get is by looking at distributions of flu deaths. This is just something I use to help me in my research. This is not what's going up in the exhibition, but you can see in south of Philadelphia, there is a rather dense set of deaths occurring down there in South Philly. There are other areas in now the Docklands, Northern Liberties, Port Richmond, Kensington, where there's dense collections of mortality over time. So that gives us another perspective there. Finally, and again, there are many examples of what we've discovered through this that have been integrated into the neighborhood efforts, the exhibition efforts, other presentations. But age is certainly one of the biggest takeaways. I've taken to give, as some of you also might know, childhood mortality is rather extreme at this time. So taking away the deaths between 0 and 1 years of age, you can see something rather abnormal here. We have this we would have liked to see a W curve. It's kind of a W with the other vertical sort of thrown away. You have a large concentration of deaths between the ages of 18 and 40, ages when people were thought to be in their prime and have a more robust resistance to things like seasonal influenzas. So it certainly is a surprise. So at the end of it, what does this get us? Well, this is a picture of mass burial where people are digging, obviously, for influenza victims. And it reminds me of that picture from Tournai, where you have groups of people working together, but working together who are experiencing an epidemic. And when we look into some of these faces, many of them appear old, or at least late middle age. And wondering now that we know what the amounts of people, what the ages of people were that were passing away, what were they thinking? What were they thinking working together? What were they thinking coming from particular ethnicities? Were they joined by common bonds along those lines? And we begin to be able to ask more questions about what occurred, combining the epidemiology and the cultural history of these terrible catastrophes. So thank you. I hope to hear more from you in questions.
Wonderful. This was great. So we are going to see if there are any questions. So it doesn't look like anyone has posed any questions. So please, if you are still with us, ask away. But I just want to ask you both, in conducting your research and working on this exhibit, what are some of the more surprising things you've both discovered?
Gosh.
Wow.
Well, I went into this exhibit into this project with a kind of ulterior motive, which was to talk about the industrial history of Philadelphia, which is something that I've been fascinated with and doesn't get much airplay in our history because we're so focused on the Revolutionary era. Mm-hmm. So delving into that industrial history was really fascinating. But what ended up surprising me, and I knew this, but was how much of an immigrant city Philadelphia was, an immigrant and a migrant city, with just tens of thousands of people from all kinds of different ethnic groups, the ones I mentioned in the presentation, but also there were Romanian immigrants, there were Greek immigrants, there were a very small but a Chinese population. So the kind of variety of immigrants that we see in the city today was definitely mirrored back then, although different distributions, different kinds of groups today. So it really ends up being an immigrant story, a working class story, an industrial story. This is not a top-down kind of history. We're not talking about the rich and famous people who died during the flu. we really want to talk about the ordinary people. And so I really feel honored being able to bring some of these stories of these people to life.
Yeah. I think for me, the big something that was unexpected, perhaps knowing what this what the age demographic was for typical victims, I should have expected, but was the fate of young mothers. There were a lot of women who were in the midst of pregnancy who had died of influenza and who had lost their child close to term as well. And not that this is not just a story of individuals passing away, but individual families changing in rather extraordinary ways and rather heart that kind of pulls on the heartstrings. And this is tough work, but yeah, it's doesn't get a lot tougher than that.
Yeah, I think uplifting the human element of this, oftentimes in the work that folks do around this type of subject matter, we get lost in the data, but actually providing a voice for the folks who are lost, I think is going to be one of the most have the greatest impact with this exhibit and with this project. So thank you for that.
Oh, and just a note on that. I've been thinking of the data and stories as not as opposed to each other, but as interwoven. That the data supports the stories.
Absolutely.
We have a story of, say, an Irish immigrant, and we can say, well, there were X number of Irish immigrant families affected. But the stories also humanize the data. And I find the death certificates to be deeply human documents. I can almost feel the people coming out of the page. So
that's great. And I'm sure if you happen to find yourself at the exhibit opening October 17th and participating in the parade on September 28th, you may also feel that. So we have one question. This is a good one. Did the large amount of deaths affect any particular industries or jobs more so than others?
Well, I can address that first, is that it was since the disease was so widespread all over the city, basically, in terms of this particular industries, they were all affected more or less equally. Would you say so, Nick?
Yes.
There were places like the Hog Island shipyards, which was the largest shipyard in the world at the time, I think employing 12,000 people or something like that. And with a quarter of the workforce down, sort of all across the board, there were certainly factories were struggling to produce their orders. One thing that I was kind of surprised to find out is that even in the midst of this terrible crisis, there were still newspaper ads telling people to give to the Liberty Loan because Philadelphia needed to meet its quota. And in the end, Philadelphia exceeded its quota. People were still buying those darn bonds as people were dying all around them. So this patriotic fervor, this pressure was so intense that people were kept working, kept striving, even though they were being sick or their families were sick.
Thank you. Thank you so much for that. And I want to thank the audience for joining us. This was great. And once again, just a reminder, you all can participate in this exhibit September 28th and visit the exhibit opening October 17th. For more information, you can go to MütterMuseum.com. .org. Forgive me. And do either of you have any parting words before we end for today?
Well, just thank you very much.
Wonderful, thank you. And
and get vaccinated.
Yes, that's the parting word. Get your flu shot.
Yeah,
Yes.
If there's anything I've learned as a historian of disease, it's the sort of that these things are now preventable does not always fall on fertile ears, and there are things that we can do to prevent large epidemics like this. So I won't get into horror stories of diphtheria and smallpox and all that, but there's a lot that can be prevented by doing something as simple as just popping down.
Yeah, we have these tools. Let's use them. Let's keep each other safe.
One more question, actually. What was the website again where we can search incidents of the reported incidents.
Okay. Well, it's not live yet, but the Neighborhood Explorer Interactive will be online sometime next year. So we have to get the exhibition up first, keep that running. But then Mike Tedeschi, the interactive mechanics designer, his next task will then be getting the interactives online, so anyone wherever they are can explore them. So if you follow the Mütter Museum, that information will be available.
I would also add your local library, genealogical centers, also have a wealth of information about epidemics. And unfortunately, because many people who die in epidemics did not die with children or were children themselves, very often these are the only memorials left are these people that are sort of died without descendants. And there's plenty of people that would love to tell you about some of rather odd diseases that, like the Spanish flu pandemic, don't get the attention that they deserve.
Oh, I should also mention that we are collecting family stories. So if there is someone if your family was affected by if you lost a family member in the pandemic, in Philadelphia, we'd like to hear about that. And we're going to be featuring some of those stories in the digital interactive, in the Neighborhood Explorer Interactive.
Wonderful, thank you. So once again, go to muttermuseum.org for more information about this. Get vaccinated, and also join us next week. Speaking of vaccines, join us next week as we talk about the current state of immunology and vaccines with Dr. Fekete, the chair of medicine at Temple University. So thank you and have a good day.